It is my pleasure to introduce Senate President Jeb Bradley and Senator Becky Whitley. They had a really busy day yesterday. Yesterday was Organization Day at the State House. And we're just gonna jump right in. Thank you so much, Senators, for being here. I do have, like Matthew Hood this morning, I do have a series of questions, but I also want to open up the floor for questions. So if there's a burning question of our closing panel that would like to start, please feel free to raise your hands.
Oh, they're going easy on us.
Okay. So I'll jump in. Senator Bradley, the first one is for you. So Medicaid expansion is going to sunset on December 31st of 2023. We had a panel discussion this morning about that. What this means is that the legislature has to reauthorize Medicaid expansion this session, so you've got some work to do. Is reauthorization on your list of priorities for this coming session? It's an easy answer. What do you see as barriers for that reauthorization, and what can we do as community leaders and providers to make sure that gets across the goal line?
Honestly, I don't see too many barriers. I think the 9 years that we've had Medicaid expansions proved to be extraordinarily successful. We've done it in such a way that protects New Hampshire taxpayers. I think the business community, I see Dave Juve back there, has been incredibly supportive of it because it helps get people back into the workforce, which is clearly an issue, and without doubt the healthcare implications of people not falling through the cracks, having health insurance and not showing up at the emergency room where care is always more expensive as it's further into a situation where people's health care is deteriorating is good for the overall system. I think we've dramatically reduced the uncompensated care, which was a hidden tax on everybody with private insurance. So I think if you look at all of the things that Medicaid expansion has accomplished, and I think the move to managed care in 2018 was really good because it's helped stabilize the individual market. I think it's been a real success story. So the dental benefit, the bipartisan support for it, it passed the Senate 24-0. Senator Rosenwald did a really good job of that. She was the prime sponsor. I think that shows, how the two sides can cooperate to get it done, and I'm looking forward to it, and I'm anticipating being the sponsor of the bill this year.
Great. So again, anybody has a question, please feel free to raise your hands, but I'm going to keep rolling. Oh, please, Seddon.
Yes, thank you very much for your comments. I heard you mention bipartisan cooperation, and I'd love to hear those two words together. We know that we're really divided and we have challenges. What can citizens do to help promote a bipartisan process? Are there things that we can do? We know how difficult it must be.
So I think that in the New Hampshire Senate, and I think that Senator Whitley would agree with me, that facts really matter. We're 24 people, we're glorified volunteers. You heard this speech yesterday. And I think because of that, there's a lot more respect amongst colleagues than certainly I saw in Washington when I was in Washington. So I think, getting back to facts mattering, that's where advocacy really works. And, we've had a lot of people that have come in 2018 and testified about the positive impact that Medicaid expansion had on their life, how they were able to get the care that they needed and go back to work. So that's where you get, not only the health care benefits, but you also get the economic benefits. And so that's how you get to yes.
I would, and I fully agree with everything that the Senate President said. I think, just more globally on bipartisan work in the State House, what makes it into the news both nationally and state level are the hot button issues. But I will say, the vast majority of what we do work on, particularly in the Senate, is bipartisan, and we are trying to think through solutions. There are going to be issues that we, very much disagree on, but, I think at a time where the rhetoric is so divided, to pay closer attention to what is actually happening at the State House, I think is really important. The details about, and even talking with your friends and neighbors about the actual work that's happening in the State House, I think that's beneficial to the overall conversation.
So Senator Whitley, I have another question. I have a question for you.
Yeah.
In 2022, last legislative session, Dartmouth Health supported a bill that would have expanded Medicaid coverage for the postpartum population from 60 days to 12 months. And we're actually seeing up and down the eastern seaboard states have taken advantage of that expansion. At the 11th hour in 2022, the legislation failed. Do you have any plans to introduce legislation that would expand that coverage for that vulnerable population?
Yeah, that was a heartbreaker. If folks aren't aware, that was legislation to extend Medicaid coverage postpartum from 60 days to a year, right? So any mom in the room knows that at 60 days postpartum, there's a lot of challenges that remain. So this was real smart policy. And again, it was bipartisan policy that was supported. Both in the House and Senate, it was bipartisan. And unfortunately, there was just political shenanigans sort of at the end of the session that happens. But no, we are absolutely planning to bring it back. And I trust that because of the bipartisan support that will be there this year. I think we are looking a little more holistically at what parents need postpartum, and in particular, what health services moms need postpartum. So I think the coverage piece is only a piece to it. We know that, it's important for health outcomes that moms retain coverage. We also know that there are certain services that would benefit health outcomes for parents. And we know that when our moms are healthy, our babies are healthy, so there's some no-brainers. So we are working on another bipartisan bill that we are affectionately calling the Momnibus. And the Momnibus is going to look at those services that we can provide in the Medicaid system and some others to provide moms the supports that they need. We're going to contemplate looking at doula coverage in the Medicaid program. A lot of states are seeing a lot of success in ensuring that moms have access to doula services, especially you may have heard in some of your different sections about the availability of OBGYN care and the fragility of our system. We need to make sure that our moms have the providers. And other things such as, there's creative solutions that states are doing around donor milk, coverage of donor milk. We know with the shortage last year, formula, that's a real panic situation for parents. So some creative solutions to really support our moms to get good outcomes for our moms and good outcomes for our babies.
Thank you. Any questions from the audience? Go ahead, please, Robert.
We've had a couple sessions today about the health impacts of the climate crisis, which are very real, as I'm sure you know. And New Hampshire is so far behind all of our New England neighbors in terms of our renewable standards. Most of our neighbors are pledging to have between 75 and 100% renewable energy by 2050, and our standard is currently set at 15. And we haven't had a climate action plan in a long time. And I guess I'm just asking, does that bother you personally, and what do you think we can do about that?
I'll let you start.
Go ahead.
Yeah, it does bother me. I will say when I think about the climate crisis, it's an imperative for me as a mom, right? Thinking about the public health impacts for our children and for our entire community. I think looking at the climate crisis as a public health crisis is really important in these conversations. I think it takes it out of the political conversations. It's also a real imperative politically, I think, for us to address it because our young people, who we are desperate to attract to New Hampshire, just desperate to attract to New Hampshire, that is their number one issue. I will say when I'm talking to young people, in addition to affordable housing, they care deeply about the climate and they are very, very anxious about, what it's going to look like in their lifetime and how they're going to have to address it. So I think it's a political imperative and it's a health imperative also.
So what I would say as somebody who was fought for biomass, for net metering, for renewable energy, portfolio standards. There has to be balance. You have to weigh costs, especially now, against benefits. New England is absolutely at the end of the pipeline in terms of energy. So what we need to do, in my opinion, is make sure that we're developing offshore wind, which we're making some progress on. We also need to enhance, I think, our net metering law and biomass, but it has to be balanced against costs, and that's always the rub. And at a time that people are struggling with sky-high energy bills, we just can't put all our eggs in one basket. So natural gas, hydro, traditional sources of energy, I think need to be part of the, part of the solution, and we can't avoid that unless, we want the economic consequences of, these high energy prices to last forever. And, it goes without saying that what the ISO is talking about in terms of reliability issues this winter in a cold snap. So there has to be balance. Energy does not turn on a dime, and it takes long-range planning and the right incentives, and it needs, in my opinion, an all of the above. And when Massachusetts folks start getting their 50% higher bills than for electricity than New Hampshire residents are already getting, I think you're going to see an outcry there too, just as we've seen here. So there has to be some balance. But I say that as somebody who's been pretty successful in getting, some biomass passed, not all of it. I wish it had been more. Certainly getting the net metering bill passed, as well as working over the years on the RPS law.
Solar and wind are the cheapest energy, per kilowatt.
Yeah, and the least reliable. So, we don't live in Arizona and New Mexico, and if you've ever lived in the neck of the woods that I live in, and you hear the opposition to windmills on mountaintops, there you go. So places like offshore wind, and let's also be cognizant of the fact that in Nantucket and Martha's Vineyard, people were aghast not that long ago. So it's not as easy as just saying, yes, we're going to do wind and solar. It has to be part of a comprehensive energy strategy that respects that people have to pay the bills too.
I think we have a question from New Hampshire Businesses of Social Responsibility.
Yeah, I'm just curious, building on that question, I'm curious about
There's a mic,
transportation
Xenia.
and any attention you are putting towards transportation in New Hampshire. A lot of the problems that we saw with health were transportation related in rural areas. We are a donut hole when it comes to recharging stations for electric vehicles. I just saw a report that we're expecting more than 200 million visitors for our ski resorts. People are coming with electric cars to New Hampshire with no place to charge them. Everywhere around us in New England, they have that. We also have federal funds that are available right now for not just electrical cars, but for mass transportation that we lack in the state. There's no way, and I tried to get from Manchester to Hanover easily without going into Boston. And so it's a lot of weird connections, and we're isolated in our communities. What plans do you have to provide more access, equitable access to transportation and an infrastructure that is future forward?
So let me ask a question. Raise your hand if you have either a plug-in hybrid or a fully electric vehicle. How many people in the room do? Okay, and I'm going to raise my hand because I have a plug-in hybrid. Okay, now I wish there was a charging station where my Jeep is outside, because I could have plugged it and I'd have, 25 to 30 miles back. And so we do need to enhance that infrastructure. But at the same time, I don't think that it is totally a government solution either. The private sector is going to have to step up as well. It will, because more and more people, even though there are not that many people here, who have electric vehicles, but as more people buy them, the demand will enhance our ability to charge those vehicles.
Right, and it's an economic issue too, right? Like, you know, again, we've been talking about workforce and the lack of workforce and the need to improve that. You know, like if we don't have the infrastructure, you know, with the charging EVs, or if we don't, you know, bring commuter rail eventually to New Hampshire, we're never going to get that workforce. So there's an economic imperative to get that done. You know, and the reality is now, like, I think at this point, you know, there is going to be a substantial amount of federal funding coming into the state through the Inflation Reduction Act. And so, you know, we need to think strategically and about how to spend that money. And I think you'll see some plan for that.
Oh, go ahead.
I just wanted to comment, Senator Bradley, I think you're on point when you talked about Medicaid expansion and the business case for doing that. I think that the same case is true for renewables, that, you know, as you're discussing this amongst yourself, I think the business case is there for the strong expansion of renewables and the business case behind it. So I'm sure you're going to use the same logic as you approach it.
I think it needs, we need more renewables. I'm not, you know, downplaying that one bit. We need more energy sources, both traditional and renewable. And it's not something that happens overnight. And I think that is something we just have to be cognizant of. And we're at the end of the pipeline in New England. We need to recognize that. And when there's warnings of blackouts in the winter, you know, when people are struggling already to pay high heating costs, we can't ignore that either. So.
And I think, you know, you're right on the business case there, and the low-hanging fruit is the net metering cap, right? Like we are holding back small businesses, you know, others. We're holding back that investment in our state, and so that's the low-hanging fruit. There's a business case, there's a public health case, there's, you know, all sorts of things. Yeah.
So while the mic's coming around, I'm going to ask a question. We've talked a lot about investments and cost. This upcoming legislative session is a budget year for you. You've got a lot of work to do. Where do you see your biggest priorities as you think about the 2023 budget?
Oh, I love how he looks at me first. So something that I'm going to be really focused on that I think is a bipartisan solution. We've had conversations in the State House over the past few years about the importance of childcare, access to childcare, and early childhood in general. And I think we're at a point where the availability of quality and affordable childcare is something that everyone agrees requires some government intervention. We are at a point where childcare is not affordable for families, for all families. It's at a point where, you know, we just don't have access to it. And we are also at a point where, you know, the people that are providing the childcare for our babies, our most precious resources, they don't get paid nearly enough. We are losing those workers to Dunkin' Donuts and such. So we have a real problem in how we fund childcare. And so there are some solutions we have available to us. We already have a scholarship program in New Hampshire that needs some updating, that needs some tweaks, that needs to reflect the economic realities of our families. And we started to have those conversations last session and the previous session, and I think this time we're really going to need to take a holistic and comprehensive look about what we can do to support our families, to support our businesses. And I'm excited about it because I see a lot of people coming together, the Business and Industry Association, public health folks are coming together, the state's coming together, so I'm looking forward to that. I think that'll be a good conversation in the budget.
So I would add a couple of things in that regard. I think it was your legislation that created a pilot program last year on admission in childcare settings. So my understanding is the department is going to include that in their budget request. I think so far the success of that is good. Childcare and affordable housing are two of the top priorities, I think, that drive our economy. And I think there is broad support for them, but the warning, I guess, is the right word. It's likely we're going into a recession. Who knows how deep that will be and what its impact will be on state revenues. I mean, the November revenue picture that we just got the other day is continued good news, but I think we also have to be cognizant of the fact that we don't know what revenue is going to look like as the budget gets to the Senate in April and May. If it's still strong, I think the case will be made that, for a substantial amount of money to go into the Affordable Housing Fund, as we did last year in the budget, I believe it was $35 million overall. We made some improvement in childcare. I think it is a priority, but we also have to make sure that what we do in the budget's affordable. So that's the reality, I think, of that.
Thanks, Senator. I do see a question in the audience. Please.
Thank you. I want to go back to healthcare for a second. So nationally, we see a trend around addressing the health-related social needs as a way to improve health outcomes. In fact, our wonderful panel this morning talked quite a bit about the connection between health outcomes and health-related social needs. One of the ways that a state can pay or at least make those connections between health and social care is through the 1115 waiver. State doesn't have an active 1115 waiver. So with Medicaid expansion reauthorization up on deck in this session, wondering if there's room in the conversation to look at that direct connection and if there's a way to sort of push the Medicaid program forward in New Hampshire through legislation rather than through an 1115 administrative waiver.
Yeah, I'd want to see what the department comes in and recommends on that before I really comment on it any further.
I think we had another question too, Melissa, right over here.
Unfortunately, I'm not up to date enough to know what an 1115 waiver is, but I wanted to ask a different question, and that is, I think last year we failed to get through allowing immigrant women and children to be covered by Medicaid. Are we going to work on that this year and get them in? We've got a burgeoning immigrant population, and keeping those moms and babies healthy is really important.
Yeah, so just a little background on that, Senators. You never saw that legislation because it didn't make it out of the House last session. So this was like the bill that would have expanded coverage for the postpartum population. This was similarly positioned where it would have been a SPA.
Yeah, I mean, that's something that we should certainly consider, particularly as we have a burgeoning new American community, right? So I represent the city of Concord, and that's such a vibrant part of our city, and I know Manchester has similar communities. So, and I would say, in the provider network and in our healthcare systems, we are seeing those new Americans really anxious to fill those jobs, so that's an important conversation.
So if we can pivot just
Go ahead.
a little bit. Senator Whitley, I have a question for you. This morning we heard a number of panels, one of which was around women's health care. Mm-hmm. In the women's health care panel, there was a question about, or discussion rather, around our workforce and attracting and retaining an OBGYN workforce. In New Hampshire's new state law, relatively new state law, there are civil and criminal penalties for abortion providers who provide medically necessary services past the 24-week abortion ban. Mm-hmm. While we still have the 24-week threshold, providers are still concerned. Do you, if introduced, would you support a piece of legislation that removes the criminal penalties from the current state law?
Yeah, absolutely. I mean, that's something that I think we have raised the red flag on since it was put into law. I mean, we heard very clear, I'm on Senate Judiciary Committee, we heard very clear testimony from our OBGYN providers, from Dartmouth, from residents, very compelling testimony about how they, are very scared about those criminal penalties and what that would do to an already very fragile system of care in New Hampshire. There were a couple bills, again, bipartisan last year, looking at how we can shore up our maternal health care system. I mean, it's a real problem in New Hampshire. So certainly I think I expect that to be a bipartisan solution, but I think we need to go a little further. I think there were conversations last session, and it's now even more of an imperative after the Dobbs decision to actually codify access to abortion in our state law. I think, again, I see it, it's a of course it's a reproductive justice issue, but I also see it as a workforce issue and an economic issue because, again, if we don't have any affirmative protections in New Hampshire for abortion access, which as many folks in this room know, it's a safe procedure that's part of reproductive health care. If we don't protect access to a safe procedure, how are we going to attract those new families to come into New Hampshire if we don't put a firm stake in the ground to say that we are a state that respects reproductive health care?
So I would take a somewhat different perspective on that as somebody that actually voted for the 24-week bill. First of all, I want to make it absolutely clear there are no restrictions for any reason whatsoever on someone having an abortion up until 24 weeks. I think that after viability, which is that standard, there is the situation of the child to take into account too. And we have a exception for the health and the life of the mother and fatal fetal anomalies. So if you're going to have a law, there needs to be some sort of a sanction for violating the law. I think the debate as to what it is, if it's maybe too much, not enough, I don't know, that'll be a debate. But I think, I disagree a little bit with Senator Whitley. If there is going to be that law, there does need to be a penalty. All of that being said, the polling in New Hampshire indicates that 70% or more of the public support what we did last year. So is it appropriate to continue to talk about fine-tuning it the way we did with fatal fetal anomalies? Yeah, I suppose so. But at the same time, I think most of New Hampshire believes that abortion after viability as a choice is not appropriate. So we'll see what happens, but that's my view.
I do have to provide a little follow-up that, I think there is a perspective about this term viability, and what I heard from providers in judiciary is that viability is really a determination for every pregnancy. Viability is not something that can be determined for every single pregnancy. So I think that is something that we do need to be listening to our healthcare providers about.
Looking forward to that debate on the Senate floor, because clearly it's going to be a good one. I do see a question on the back of the room, Melissa.
Well, that's one of those things that now as the presiding officer, I don't have to get involved in the debate. I like that.
Yeah, thanks for taking my question. I wonder if you could talk a little bit about what your revenue projections are for the budget, where you might see some surplus, some opportunities for one-time investments using that surplus, and just put in a pitch for potential student loan repayment for those really critical professions, especially in healthcare, where I work, in behavioral health, mental health, substance use, trying to draw a workforce from all around the country, because we're ultimately just stealing from our own resources and the network that we have in New Hampshire. So making New Hampshire a attractive place to work would be my initial advocacy for some of that one-time payment, as other states around us have done. So would love your thoughts on that. Thank you.
So I believe it's Senator Carson will be filing a bill that, is brought to us by New Futures on expediting licensure to make sure that, healthcare, in particular mental health workers, are attractive in New Hampshire, and I think we need to move forward with that. In terms of the student loan repayment issue, we have put surplus dollars into that to help people in the past. I mean, again, like, what I said before about affordable housing, childcare, we'll have to see where we are with a revenue picture in the future, in, April and May timeframe. These are all priorities that we should try to fund, but you can't do everything, and you do have to prioritize. I think it goes without saying that attracting healthcare workers to the state of New Hampshire is an absolute priority. I worked with Senator Rosenwald a couple of years ago to enhance Medicaid rates. I mean, that's a vitally important thing. I'm glad we did it, but it does have a cost, and you always have to balance that.
Yeah, I would say, thinking through the availability of surplus funds, we have the opportunity to get a little creative. And one thing that I'm contemplating is we are one of the very small handful of states that does not have access to pre-K or state funding for pre-K beyond sort of special populations. And so when you are in a resource scarce state, as we are, you have to think through those interventions that are going to give you some bang for your buck. And we know that a lot of those early childhood interventions do give you that bang for your buck, both in social benefits for the entire community, but also for individual outcomes. So we have the opportunity, again, to do a bipartisan look at pre-K. I think surplus dollars is a good use of that. On the sort of loan repayment issue, we're also looking within the childcare workforce, what are those things that we can do to support that workforce? They're beleaguered right now, right? Not only do we, and I see folks nodding their heads, not only do we need to get new folks into that field, but we need to make sure that the folks that are in the field stay in the field.
So Senators, we are running close on time, but I want to give you an opportunity to provide closing remarks if there's something I forgot to ask or we didn't have a chance to cover.
Thank you very much for inviting both of us. It's been a pleasure to be here. You know, I think that in the New Hampshire Senate, we have had a long tradition of listening to people, trying to be very open and approachable. We can't do everything. We have to, as I just said before, balance costs and needs and prioritize things. But I look forward to continuing to serve on the Health Committee. And I expect that a lot of you will be coming in front of us. And Senator Whitley will be on that committee too.
Yeah, so I also serve on Health and Human Services, and I would maybe use this time to just have a plea to you all to come to the State House to provide your expertise. I mean, we really do rely on folks coming to us with the data. You know, I'm not a healthcare provider, so bringing that evidence to us, I think, is really important. We really pay attention when experts do come to us and provide that the evidence-based solutions, and to focus on, look, we know there's a problem, but what are our solutions? We need to hear from you about that. So I look forward to working with everyone on those.
And thank you, Senators, very much for being here, for spending your time with us this morning. I want to thank you all for attending the symposium. It's been a pleasure to have you. We will be posting the recordings from the keynote, this closing panel, and all the breakouts on our website. So you can find that on the website that you registered at. So if, like me, I haven't figured out how to be in two places at once yet. So if there was a breakout that you didn't get to pop into but you wanted to see, those will all be online. Additionally, if you'd like to dig in a little bit more, there's a flyer in the folders for our 2023 ECHO session that will cover the political determinants of health. We're going to have 10 sessions throughout February through May and June, and we're going to be exploring and looking at some of the work that you guys are doing and some of the work in the administrative space too, ARPA spend, some of the actions that the governor and the executive council are taking also. It's often said that politics is New Hampshire's sport. So I hope that today helped motivate you to at least become a closer spectator, but maybe hopefully to suit up and get in the game a little bit too. So thank you all for being here. It's been a pleasure to host you today.